registered dietitian.
Hi, I'm Kevin. I'm a registered nurse.
We are the certified diabetes educators for the Shoshone Bannock Tribe's Diabetes Project.
We have put together a series of videos using materials from the International Diabetes Center and our tribe to answer some of the basic questions of diabetes. It is natural for diabetes to change over time. That's why it is important to follow your diabetes success plan and monitor your blood sugar trends. These changes happen at different times for different people. Types of changes that happen over a number of years include the body's cells become more resistant to the action of insulin, the pancreas first makes more insulin and then less, the signal from the gut can weaken, less insulin is released with meals, and more glucose is released from the liver. As these changes happen, your treatment plan will change. It is important to see your provider to discuss treatment changes if your blood sugars become out of range for more than 4 days or most of the week. Because diabetes does change over time, your healthcare needs change too. Visit your healthcare team every 3 to 6 months. Together, you will review your A1C and other laboratory tests. You will discuss your care plan and decide any changes that may be necessary. Complications occur when blood sugar levels are high over time by damaging nerves and blood vessels. High blood pressure and abnormal cholesterol levels add to your risk. Any reduction in your A1C is a step towards better health. Blood sugar levels that are high most of the time can lead to serious health problems. These problems do not happen overnight. You can take the steps to prevent, delay, or slow the process by keeping blood sugars in target.
Common complications that are caused by high blood sugars over time include, with the brain, research shows that frequent high sugar levels or very low blood sugar levels can cause memory and learning problems. Heart and blood vessels. Damage to the large blood vessels can lead to buildup of plaque, causing heart attack and stroke. To the eyes, damage to the small blood vessels in the eye can lead to vision problems. High blood pressure worsens eye disease. To the kidneys, damage to the small blood vessels in the kidney makes it hard for them to remove waste from the blood. It can also cause high blood pressure or make it worse. Feet and legs. Damage to the large and small blood vessels slows circulation and harms nerves in the feet and legs. This damage decreases the sensation in the feet and legs and can lead to infections in those areas that are difficult to heal. To the nerves, nerve damage can cause difficulty with emptying the bladder and with digesting food properly. It can lead to nausea and vomiting because food stays in the stomach longer than normal. Sexual function. Nerve damage can also interfere with the body's sexual response and function. This problem can happen in both men and women. And to the mouth, high blood sugar levels can cause natural bacteria in the mouth to multiply. More bacteria increases the risk of gum disease.
Feet problems start with numbness, tingling, pain, or sores that will not heal. Taking care of your feet every day helps prevent these problems from becoming serious. Keep your feet clean. Wash the feet daily with mild soap and water. Do not soak feet. Soaking can make your skin dry and cause cracking. Dry your feet well, especially between the toes. Trim nails straight across. Check your feet daily. Use a mirror to check hidden areas of your feet or ask for help. Look for any cuts, sores, or signs of infection such as redness, swelling, pain, or drainage. Protect your feet and avoid temperature extremes. Wear well-fitting socks and shoes or slippers even indoors. Buy shoes later in the day for a better fit as the feet swell during the day. Treat your feet nicely. Use cream or lotion on dry feet except between your toes. Do not use chemical treatments, sharp instruments, or abrasive materials on corns, calluses, or ingrown toenails. Clean and treat minor blisters and cuts. Contact your team in a week if they are not healing. And see your health care team. Remove your shoes and socks at every visit to remind your care team to check your feet. If you have a foot problem, ask your care team for a referral to a podiatrist or foot doctor.
Heart health is important because diabetes increases your risk of heart disease. Everything you do to control your blood sugar level helps keep your heart healthy. The more risk factors you have, the higher your risk of heart disease. Some risk factors include having an A1C that is 7% or higher, having high cholesterol, having blood pressure readings that are 140/80 or higher, smoking, or eating a high-fat diet.
High blood pressure puts extra strain on the heart. It also can damage blood vessels in the eyes and the kidneys. Blood pressure is recorded as two numbers. The top number is the systolic blood pressure. It is the pressure when your heart is contracting. The bottom number is the diastolic pressure. It is the pressure when your heart is relaxed. If either number is high, your risk of heart disease is increased. If you have diabetes, your risk of high blood pressure is 3 times higher than other people who do not have diabetes. If diet and physical activity do not control your blood pressure, you may need to take 1 or more blood pressure medications. Have regular blood pressure checks. Keep your blood pressure below the target given to you by your care team. For most people who have diabetes, the target is less than 140/80.
Some risk factors for heart disease and blood pressure cannot be changed, such as your family history. Others are related to lifestyle and can be changed. Once you understand your risk factors, you can take steps to reduce them. Here are some tips to help protect your heart. Do not smoke. Choose low-fat foods and use low-fat cooking methods. Avoid foods with saturated and trans fats. Eat fewer salty foods and avoid using the salt shaker. Include plenty of fruits, vegetables, whole grains, and low-fat dairy products. Eat 2 servings of fatty fish per week. Be more physically active. Lose 7 to 10% of your current weight if weight loss is needed. Otherwise, continue to maintain a healthy weight. Limit the amount of alcohol you drink. Ask your healthcare provider if taking an aspirin daily would help protect your heart. Balance the stress in your life. If stress is difficult to manage, talk to your care team about a referral to a mental health provider.
A physically active lifestyle can keep your heart strong. Heart-healthy activities makes your heart beat faster. Walking is one of the simplest and best physical activities for your heart. First, add steps to your day and then step up the pace. Over time, try to keep up the pace for longer periods. Other physical activities that boost your heart rate include aerobics, swimming, hiking, biking, and exercise videos. It is important to find an activity that you enjoy and get your heart pumping.
Goals to keep in mind are continue to monitor and track your blood sugars, limit high-fat foods and use heart-healthy fats more often, limit sodium intake, and if you are a smoker, begin working through a plan to decrease or quit smoking.
For further information regarding any of these topics we have covered in this video, please contact the Shoshone Bannock Tribe's Diabetes Project for an appointment. Thank you.